Hello, 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 everyone. Thank you so much for tuning in to Holistically Healing Me. I am Ardelia Jones, and we have our wonderful guest speaker tonight. Her name is Dr. Shedel. I am so glad to see you, Dr. Shedel. I am so happy to see you once again.
It's so
It was
good to see you. I'm so excited to be here tonight.
Yes, we had a wonderful the first time that we met. It was absolutely wonderful meeting you. I was so very intrigued by everything that you do, and I'd like for you to take out some time to actually speak to all the people and let them know a little bit more about Dr. Williams.
Yes. So I am Shedel Williams. I was born and raised in New Orleans, Louisiana. I've been living in Houston, I guess, for the past 8 years now. I started my first job here as a physical therapist. So I moved from Birmingham, Alabama to Houston to work at Memorial Hermann in the cardiovascular ICU. So it was
Wow.
way too intense for a new grad, but I survived and it taught me a lot of amazing things that I still use in my career today. So I specialize in dry needling, and that looks like acupuncture, but it's great for pain relief. I see a lot of people with old injuries, chronic issues they just can't get rid of, tightness, migraines, anything you can think of. So I do a little bit of both. I still go into the hospital and help out in the ICUs. I do outpatient for, people like me and you that are at home and say, oh, my back hurt or my knee hurts. I need to go see somebody. So I'm a physical therapist, and dry needling is my specialty.
Awesome, awesome. And as you mentioned that, there's so many different people that have so many different types of injuries.
Yes.
And the fact that you can actually do something with them that is a little bit more uh, on the alternative medicine side
Yeah.
versus where individuals are actually having to deal with more of the pain meds. Can you talk to us a little bit about that? Because you mentioned a lot with, knee pains, which means that it'll be the joints that could be connected
Yeah,
to fibromyalgia, could be connected to an injury from, a long time ago, failed car wreck, all types of things that can
absolutely.
take place. Yeah. So let's talk to them about the alternative medicine part.
So honestly, that was my decision. I always knew I had some interest in medicine. And I had one of those mothers that's like, be a doctor. So I really kind of took my time and decided like, well, what was make me happy? And so I thought I wanted to do anesthesiology. Thought I wanted to do pediatrics, but when I really thought about it, I didn't want to just only be able to intervene with pain medicine or surgery. So that's what
Mhm.
kind of made me go into therapy, because we use our hands, we use exercise, we use tools to kind of help people avoid some of those things. So a lot of people aren't even candidates for surgery, and now we have this opioid crisis. So now a lot of people are going towards physical therapy. For a while, chiropractic was like the standard in people's mind when they thought, "Oh, I hurt my back, I'm gonna see a chiropractor." But now I think people are more educated with physical therapy. So we treat a vast array of illnesses. A lot of
Mhm.
people don't really understand how physical therapy, how you would have a career working in the ICU, which is, like I said, where I started. But early intervention, getting people up out of bed soon and quickly after a surgery, not allowing people to lay in bed and get pneumonia, end up on a ventilator. So we, see people before injury, to make sure everything is in line and you're not harming yourself. We can see you right after surgery, or if you just, hurt yourself and need somebody to do some interventions with you.
Yes. Now, see, I think that that is absolutely wonderful. Simply because, like you mentioned, with opiates being such on a rise, and there's such a mass epidemic with that, that this is certainly a great way for individuals to be able
Yeah.
not to have the pain meds,
Mhm.
addiction. Um, One of the other things that I remember that you've done was preventative maintenance.
Yes.
And I'd like for you to talk to us a little bit more about the maintenance part.
Yeah, so one thing that I do is I believe in treating the whole body.
Yes.
So when you come to my clinic, if I'm ever your physical therapist, I want to know, how do you sleep? You know, what are you eating? What's your mental state? So with treating the whole body, physically, one of the things I look at is your alignment. So I have this little machine I'll stand you on and check your alignment from the ground up. And basically, I look at you before and after a corrective insole. And preventative medicine for myself, I don't have any pain. If I have pain, I treat it immediately. But I still wear, I still take a dose of my own medicine per se, wear my insoles and do my things because I don't want to end up with these injuries. And so that's one of the things that I wish we were better at, catching people beforehand, before something
Yes.
bad, because, it sucks to have to only treat after something has occurred, after you need a surgery, when there's so many things we can be doing beforehand that would keep us out of pain, sickness, illness, under the knife, on opioids. Even over the counter medicine destroys our stomach. And so,
Absolutely.
you know,
Absolutely.
I,
The danger of aspirin most
yes,
people don't know that the danger of aspirin, when you are consuming it
yes,
on a daily basis. uh,
ulcers,
yeah, ulcers are huge.
yes,
And also, it has a lot to do with the acid reflux,
hmm,
digestive tract, all of those things. It truly affects it.
yeah,
I know that with me, my major is nutrition science. So I'm always talking about something in regards to, oh, you can do this and this,
yes,
and that would definitely help you. I can speak for that as, a major testimony for myself when it came to having fibromyalgia. That was one of the things that I began to go back. I had to go back and remember the way that I was raised, which was, very holistically, and then as well as being able to use my background of nutrition to change the way that I ate, learning about gluten free,
yeah.
learning, about organic and the difference with the soil for your fruits and vegetables and things of that nature. The things that most people don't even realize how they're allergic to certain things, and that's what's causing the inflammation. And you're like steady taking it, you steady eating it, and
Yes.
really allergic to it.
You are about to get me on a soapbox right now. I went off on the Doctors in Memorial Herman one time because I'm like, how are we allowing our patients? I had this one gentleman. He had a really intense procedure and he could not get out of the ICU because he had something wrong with his bowels. And I went into his breakfast to do physical therapy and I'm like, he needs all his strength. He's very weak, but we have to do it. And I look on his tray and I see Frosted Flakes. And I said, Mrs. So and so, is this your breakfast? He's like, yeah. I said, is this all you had? He's like, yeah. And I'm like, I'm relying on Frosted Flakes to nourish this man for physical therapy to heal his bowels so that he can, have a bowel movement, get him out of the ICU. We're relying on Frosted Flakes. And I went to the whole team and I just was like, y'all, come on, we have to do a better job. This is not making
Absolutely.
any sense.
Yeah, and I don't know how far I want to talk about that. There was one part I really wanted to get into, and I can't. I'm not sure on how far I can get into that. But some of those things, like you're saying, I have had 20 years in
Hmm.
traditional medicine.
Yeah.
And when going back and looking at certain situations, it was so crazy how individuals come every 3 months.
Yeah.
Every 3 months, they come and they get their checkup and everything to see if the medicines is affecting their kidneys or if it has affected anything within them, and it just disturbed me
Yeah.
because so many things are preventative because of what we consume.
Absolutely.
Mhm. And that the sad part is that there's not enough education on
Yeah.
one, nutrition health, and then the other one being alternative maintenance
Yes.
is the other major one, that I think that we're not really um, diving into the way that we really need to.
Yeah.
It's just like, whoa. Whoa. We can look at pharmaceuticals versus nutraceuticals, which is what I custom blend as nutraceuticals.
Mm.
And people, when they hear the word nutraceutical, they're like wondering, like, what is she talking about? What
Yeah.
is she saying? But you can heal a body naturally can
Yes.
heal itself.
Yes.
It can definitely naturally heal
It's
itself.
designed that way.
We are. We're actually made that way,
Yeah.
and it's so sad that we're having more information in regards to the nutraceutical side versus. I mean, the pharmaceutical side versus the nutraceuticals on things that you can actually take that will help your body get right back into the sync of things.
Yeah.
Um, I know that you speak a little bit in regards to. I think there was two other things that you do that I thought was like really, really, really intriguing, as being a PT. Because normally PTs, we hear of them are more in the instance of occupational health.
Yes.
Hmm.
Hmm.
Versus, no, this can actually be used, for all individuals.
Yes.
um, you can elaborate on that if you.
Yeah, so that's literally how it came about because I didn't really have a desire to go off and start my own business and try to fight against the system, but it just wasn't right. And I saw the ways that we were really dropping the ball, and I saw how our community was so negatively impacted more than others.
Yeah.
And I just felt I had to do something. And so that's what led me to go off and start my own physical therapy company. And like I said initially, it's not just, come in, do some exercises, let's get you back running back to work. We have to really address the body as a whole. So
Yes.
we talk about what are you putting inside of your body? I talk to people about their mindset.
Yes.
I really do. And I say, healing your body starts within your mind. You have to believe you can be healthy. You
Mhm.
deserve to not be in pain. I see so many people say, if. And I'm like, the body is so remarkable. It's
Yeah.
not concrete. None of this is stuck in place. Like, if I slash this off, it's going to heal. So, what do you mean if you can be out of pain or if you can get well? We regenerate cells all of the time.
True.
We every day cells are turning over. That's how we have dead skin, our organs. So it's a holistic approach. So one
Hmm.
of the things that I do is an alignment analysis. You stand on a machine and we're going to see how does your body relates to the ground because that's the foundation of it. I want to
Absolutely.
know, how do you feel about actually getting rid of something that you may have been identifying with yourself? Saying, I am so and so and I have this condition. Sometimes
Mhm.
we attach things to ourselves, and I have to ask people, are you ready to get rid of this? Because sometimes it is. Sometimes, it's like,
That's major.
it is. And you have to help people to understand you have been associating this with your identity, actually. And
Wow.
you have to actually be ready to throw this off because we can do it.
Mhm.
But if you say, I am so and so and I have anxiety, I am so so, I have arthritis, and it's just your part of you and it's your crutch, then you have to know that, you're ready to rid yourself of that. You're ready to be healed. And we can work together to, actually bring about some healing.
I got so excited about this, right? that I didn't even say. We have a wonderful topic tonight. I normally say that, but we just started diving in because this is just a wonderful thing, a wonderful, wonderful discussion to have. Not just because it's the beginning of the year, but I think that sometimes when it comes to individuals, it just something about starting anew makes them want to do things differently.
Yeah.
My thing with that is that you, like you were saying, are you ready? And this is a time that I believe, that God wants us to get ourselves ready. We have to do better
Yeah.
for ourselves. And the way that we have been looking at this is just, oh, hey, Michelle's on. um
Hello.
we have to do so much better with what we're battling. And you can have all these thoughts and go to the different physicians, you can go to all these different places and things like that, but I think that it truly truly starts with the individual
Yeah.
and knowing that they are ready. First off, let's go with back to our topic. The topic itself is called recovering your health. And
Yeah.
that's kind of where I wanted to focus on because that's what we really need our mindset at. I want to recover my health. You
Mhm.
have to have, it has to be a driving force for you.
Yeah.
It was not easy. It took me about 4 years to get back balanced the way that I needed to be.
Yes.
It takes time, it takes dedication, and you have to be willing to want to make that change.
Yes.
And I think that that's where a lot of people go wrong is that they not so sure on if they really want to dedicate themselves. It's like you can start out doing it. You can start out being so well, and oh, I'm going and I'm doing this, and okay, well that treadmill that hurt my back. I can't
Yeah.
I can't do that, or I'm gonna have to do this today. So I'll make it up on the latter end, and then before you know it, you're back sitting in that same position that you were in previously
Yeah.
before. So what I have conditioned myself to do with others when I am doing nutrition with individuals, that's a very difficult thing. Did you know that?
Listen, nutrition. Good luck.
I'm t-
Good
Nutrition
luck.
therapy is difficult. It is difficult with individuals. One of the main things is that people don't like to be honest with themselves,
Yeah.
and
Yes.
it could be very, very, very challenging.
Yes.
And I also wanted to mention our scripture. I had came from Psalm 73:24 and 26. It says, "You guide me with your counsel, and afterwards you will take me into glory." When the word of God is saying that you take me into your counsel, that is when our mind is saying, hey, I'm gonna have to lose this such weight, or I'm gonna need to start doing this differently. And we can have that conviction within ourselves. But like we were saying this right now, is that one is having the conviction, the other part is having the dedication,
Yes.
and knowing that this is not where you're just doing some things because this is the beginning of the year,
Mhm.
but having the mindset this is a lifestyle change.
Yeah.
uh, I think that that's when things seem to be different, is when we present it as lifestyle change. What do you think about that?
For me personally, that's the only way I can keep up with anything is if I make it a lifestyle change.
Mhm.
We have this concept, it's too much too soon in physical therapy. You can't get out there and say, okay, the Houston Marathon's coming up. I haven't ran in a couple years, but I'm gonna go out and run a marathon this Sunday. You're gonna hurt yourself. Okay. I know our mind tells us, I still got it, I can do it, but it's too much too soon. And you're
Mhm.
never, ever, ever gonna keep up with anything where you just go gung ho and then you're gonna fall off. So for me, if I really want to make a change, I have to make it a lifestyle change, which means it's something in my mind has to shift and I have to make adaptations that I can stick with over time, something that's realistic. And like you said,
Yeah.
be honest with yourself.
Oh wow, that's a big one.
That is so important because the point is to where it's habit and it's just a part of you. You're not depriving yourself. You've literally just modified your lifestyle. It's like,
Mhm.
taking a new route home from work. So lifestyle change is so important, and that is something that I deeply believe in. In terms of recovering our health, I think one of the major things I had to realize was God created us and he gave us this earth as a gift.
Yes.
As a gift. And I have a 5-year-old. And I do things because I want to see her reaction. I want to see her smile. I give her things because I like to see her happy and get excited
Yes.
about something. And that's how we are to this earth. We were not sent here to be sick. And
That was never the plan.
we're not sent here to be
That
sick
was never the
and
plan.
in our mind and and beat up. It was like, no, this is yours. This is your gift. And so when I kind of really understood the concept of like, wow, health is my birthright. It's part of, my
Yes.
right to be healthy, to be happy. It was like, okay, well, let me stay in line with what was ordained for me and not think some weird thoughts or I deserve to be hurt or in pain or poor or whatever.
Hmm. That is so true. I absolutely agree with that. It was predestined for us to be of good health. It
Yes.
was predestined for us to be and live a life that was plentiful, was bountiful. If it was not so, then why, in
Yeah.
Genesis he said to be fruitful and multiply. It
Yeah.
was all set up in that manner that you would definitely multiply.
Mhm.
God is a God of multiplication. So, with that being said, I have seen this when I have worked in alternative medicine, and and that's different too. So I want to commend you now for stepping out and doing it where you're dealing with the body, the mind, and the spirit. That's what holistically is healing me is all about. And I noticed though when I would work in alternative medicine that had that concept of body, mind, and spirit, a
Mhm.
person could be coming in for cancer, and I'm talking four-stage cancer,
Mhm.
and everything can be turned all the way around.
Yes.
And plus, with putting, the principles of God in there, giving them, building them up with faith.
Yes.
And that's a lot of times what needs to happen as well is that life circumstances happen.
Yes.
They just happen. And not having the know-how, the word says that is like my people perish for the lack of knowledge.
Yes.
When you don't have that know-how on how to turn a situation around, it just amazes me when you do have people such as yourself that is out here that wants to help our community
Yes.
to grow for themselves, to be able to see that you are prosperous. Let me teach you how.
Yes.
Hmm. I think that is so wonderful because that's usually all that it really takes. Um, I know that one of the other things that you were more geared to with besides having the needling, I thought that was just wow, and the preventative maintenance and preventative health part that you also do, and you said that you also deal with people psychologically.
Yes.
How do you begin to prepare them for this transformation? Because that's even like someone that can go in and have surgery. They can
Yeah.
have surgery, they can have weight loss surgery, but yet and still they still see themselves,
Absolutely.
that phantom,
Yes.
and that phantom syndrome where you're
Yes.
thinking of yourself and being this one way when you're really not.
Not, yes.
Yeah, so how, what are some steps, what are some things that you actually do that helps them psychologically prepare them for the transformations?
So you mentioned something earlier where you was talking about we we have to take it upon ourselves to heal ourselves. We're
Mhm.
not at the point to where if we don't, we're okay. If we do, we're still okay. We're on this cusp of where if we don't get our health and our lives together, heart disease is real, strokes are real. It's real consequences here.
Yes.
And it's not when you're 80 anymore. Now
No.
it's happening in your 20s.
Mm-hmm.
Kids are having juvenile diabetes now, kid obesity. So now they're starting the process way earlier. So I tell my friends this all the time. I'm like, it's not really a choice. We have to get our lives together, mind, body, and spirit.
Mm-hmm.
So to start to prepare people for the process is really more so of a twofold thing.
Mm-hmm.
It's some psychological with some simple things. Are you ready to be healed? Is it something that's really pressing, that's very present in your mind that could be expressed through your body? And what I mean by that is I currently have a patient and she opens up on the table. It might as well be a psychologist's office sometimes too. About some traumas and some debts. And I'm like, this is going to express itself through your body. So
Come here.
some of it starts psychological, but we're not just all, I'm not a shrink.
Yes.
So we're going to address the physical part of it. This is where we're going to start. We're going to get you out of that 10 out of 10, 8 out of 10 pain. I'm going to bring the pain down to nothing or something way more manageable so that your mind isn't just consumed by pain. It's hard to think, it's hard to be positive and happy when you're in real pain. So we're going to take the pain down. I can do that with my physical therapy, but we have to start to address it comprehensively. So we're going to
Mm-hmm.
take the first week or two just to get you out of the real hurts, bring it down. But this is what we have to do. We have to make a plan. That's what my evaluations are. I need to see you, put my hands on you, talk to you to make a plan.
Yes.
And we
Mm-hmm.
have to plan. And that is gonna start there. Some psychological questions that we have to start to deal with that because I don't think we're gonna ever reach the goal. My goal is that people are completely pain free. They can do the things that they love and they enjoy. If it's riding your motorcycle, if it's playing with your grandkids, if it's swimming again, it doesn't matter. My goal is that you're able to have a quality of life. It doesn't make sense to just
Wow.
be alive. You have to
That's
have
it.
quality.
Mm-hmm.
So it's gonna be that twofold scale.
Yes, that is, you know what? That's excellent because that's one of the things that I always speak to people about is what is your ideal quality of life?
Hmm.
Sometimes you have to really, pull them into visually seeing themselves and what do that really mean to me? What do that mean to me?
Hmm.
So it can't be as much as you try to tell or say this or that. It definitely have to be where it's so personalized.
Yeah,
That makes things move a lot differently versus when you're just structurally saying, and that's the different between the systems of what it is that you do with
yeah,
alternative health versus traditional health. I'm not going to ask you in regards to what it is that your quality of life is or what is it that you really
hmm,
want to
yeah.
achieve in life. It's not that.
It helps me too because I know I went to school and I was taught something by the book. So I can get into that mode. I want your strength to be a 5 out of 5. And all of these quantitative measures that doesn't really, it may not translate into you being happy.
Mhm.
If you can really kick your leg up as hard as you can, okay, does that really mean that you're gonna, enjoy your life and be able to, play with your grandkids? So it helps me understand, these are people that have been affected by something bad,
Mhm.
and it's weighing on them personally because they can't run anymore or whatever it is.
Yes. I think that a lot of times, and you kind of touched a little bit on this, emotional trauma is real.
Hmm.
And it too can weigh in on the migraines. It can weigh in on the pains and emphasize things in such a way because of emotional trauma.
Yeah.
And a lot of times when you're able to work with them with those particular type of techniques, that really eliminates a lot of tension that they
Hmm.
have had built up. uh,
Yes.
it's amazing. It's just amazing how that works, because our mind is our biggest tool. So
Yes.
if you can actually be able to work with someone where you're dealing with them for that mental part, as well as the physical part, and
Yeah.
then the spiritual part, I mean, that's wholeness.
Yeah.
So I am so excited about this is awesome. You
Yeah.
had touched on something that I think that a lot of people really need to know more about, and that's heart disease and stroke.
Hmm.
The numbers have skyrocketed
Yeah.
over the last 10 years. Many things of the reasons is, on that. We've had COVID that has taken place that placed people in a very harsh,
Yeah.
mindset, as well as other things. And then, the fact of the downfall of the economy
Yeah.
has caused others to be like that, to be into, some people can even have depression, and it is actually have reverted into some form of pain within their bodies.
Yes.
Hmm. And I think that a lot of times we have been taught that depression looks like this and
Hmm.
it looks like that, but that's not the reality of it. It could be in so many different forms, honestly. It can be in so many different forms, and then which is another reason on why many people eat poorly.
Yes.
Don't even know that that's the reason why, that their bodies are actually craving it. uh,
Yes.
Feed something else.
It's a outlet to satisfy something that it's not really going to, but it's a filler for something
Hmm.
that is really going on internally. And you are so a trillion% right. Our mind is so powerful, whether
Hmm.
it's powerful in a good way or powerful in a bad way. We have a DNA strand that's so long, but everything in our DNA isn't turned on at one time. Our mind tells what to be turned on. And that's just a instruction manual of what to produce in our body.
Wow.
We think, oh, my whole family had diabetes, my whole family died from heart attacks, it's going to happen to me too. That may be in your DNA, but we don't have to turn that on with our mind.
Come here now. Yes.
Mind is powerful, good or bad. You get to choose.
You get to choose
Yes,
what is going to be for you. Just because that is something that runs in your family don't mean that that belonged to me.
absolutely not.
Let me figure out how that was one of the ways that I had came up with the nutritional program
Hmm.
for when I was going through the symptoms of fibromyalgia. And that was one of the major things that I done when I came up with this nutritional plan. And I also had formulated capsules that it worked against the symptomatic things that
Yes,
this brought on. And I think that that's another thing that not taught. You can work against whatever the symptoms are for different diseases. Are
yeah.
you excited like me?
I am excited because I am over here excited because it's not taught and it's so true, but it's just like,
Because you don't know what you don't know.
yeah,
And just to think like, wow, so I can actually do things that is going, yes. if
Yeah.
if it's saying that, if someone has said that you're pre-diabetic, what that's telling you is that your, your glucose raises or elevates. What can I do really to help bring it down then? Because that
Mhm.
would be the opposite of what is being done.
Yeah.
So most will say, oh, that means that I get rid of anything with the sugar, so I'm going to stop eating sweets. Well, yes, of course you use those things in moderation,
Hmm.
but the other thing that you have to look at is being able to do those cleansers, the tonic cleansers, that
Hmm.
is going to keep your blood purified.
Yes.
That too is going to help your glucose levels,
Yes.
you know. And then you also have the, a lot of people say, well, that means that I won't be able to eat any carbohydrates. Well, yes, but then there are good things that you can actually have. I believe in not telling someone, oh, you can't have this. When
Yeah.
anytime that I do nutritional therapy, I don't ever use the word you can't have.
Hmm.
I normally, what I do is I try to tell them, let's substitute this for this.
Yes.
And when, and that this is going to be better for you. You're going to see better results. All you have to do is try it out. Try it out for 30 days, and you're going to see the difference in
Yeah.
your whole body, where you'll have more energy, where you'll feel fit, where you'll see yourself like, wow, I could not wear these pants before. And you didn't, you didn't go on no hike or
Yes, but that
anything.
creates a lifestyle change.
Yes,
That is how
yes,
you make a modification, because if you say no more sweets,
yes.
people are gonna stick to that if they buy into it. Because I would
Hmm.
be like, I wouldn't even buy into it initially. If they buy into it, that's gonna last for a month, and then people are gonna start seeing the commercials, and they're gonna pass by Dairy Queen. The way
Yeah.
that you do that actually creates a lifestyle modification, because it substitutes something, and people get the positive reinforcement when they start to feel better.
There's nothing like, that rewarding yourself when
Hmm.
you actually can see it. So you feel rewarded. Again, we're going back to the mental, the state of mind.
Yeah.
So it just makes a big difference on success, because it can happen, or having the healthy way of living. I am one of those that truly, truly believe that when it comes to alternative healing, or the body healing itself, that there's so many other things that we can do as well. I am really huge on being able to take certain vitamins. Most
Yeah.
people do not believe, or don't know um, the healing that vitamin C does. They
Hmm.
think that you only take vitamin C because that's going to, prevent against colds. That's the only thing that they can associate it with. But actually, just having, vitamin C, it helps with so many other components within your body, which
Yeah.
allows you to be different. And also, oxidation, breathing, all of those things are just significant and important. I know that with PT, that's a lot of the things you teach people breathing techniques as
Yes,
well. Mhm.
absolutely. And we started when I was at Memorial Hermann. We started the lung program, so we started to do lung transplants, and I was actually part of them.
Oh,
The
wow.
program where they got accredited to start taking lung transplants. So breathing techniques is a very essential part of your healing. And you would be surprised, because it's actual. We've been talking so much about the mental state, but it is actually, I saw a patient today. You have a certain type of anxiety that's expressed when you're not getting enough oxygen. And so, breathing techniques, us doing breathing things to help people move secretions and maneuvers and stuff like that, is a huge part of physical therapy for sure.
Oh, yeah. It even unlock muscles when muscle spasms. The
Mhm.
if you're that was one of the biggest things that would happen when I was in full-fledged, or fibromyalgia, is that I would have muscle spasms. And I didn't realize that each and every time that when I would get these
Mhm.
chronic muscle spasms, and it wasn't like the muscle spasm where you just get the trolley horse in your
Yeah.
leg, and somebody tell you, oh, that means that you don't have enough sodium in your body. I'm like,
They're like, eat a banana.
yeah, eat a banana. Just eat the banana. And I'm like, no.
Yeah.
I had to realize that every time that my body would lock up like that,
Wow.
my breathing,
Mm.
it's at the same time I'm because
Mhm.
you're all tensed up. And when I started to actually just breathe in and
Yeah.
breathe out, it was amazing how those type of things really changed within the body.
Yes.
That's with anything though. I think that has a lot to do when you said that. I had never ever heard it like that about breathing with anxiety.
Yes.
And I know that that's true
Mhm.
because usually the heart goes into palpitation.
Yes.
So
I've heard that before. Yes.
I know that that is true. It is
Mhm.
associated with anxiety. My goodness, you're good. I like it.
Well, thank you.
Yes, that's awesome. That's awesome. So we're down to like some of the last minutes. I want everyone to know about your clinic if they're in Houston so that they can come by. And if
Yeah.
it's just frequencing it, or either how they can call you, or how they can get in contact with you, if you have Facebook or
Yes.
IG or whatever, just your website, just give us whatever you can, pour it out. And then also let us know if you're going to be a part of any other type of conferences or anything else or lectures that you're going to be doing here within this year that people can start tuning into.
Yes. So the name of the clinic is the Woodlands Physical Therapy and Recovery. And so we're located at 200 Valleywood Drive. And I know anytime I mention the Woodlands, if people do not live in the Woodlands, they're very apprehensive about coming to the Woodlands in Houston. But the good thing about me and my clinic is you don't have to be local. I've met people on Instagram and have had consultations and been able to make recommendations and do things that people can still get relief, even if it's me referring them to the right physical therapist or another type of specialist. So if you have any question, even if you don't think it's body pain related, if you have a question, you can call me. The telephone number is 409-332-6199. You can call or text. My email address is contact at woodlands, woodlandsptar.com. So feel free to call, text, email, um, even if you just have questions, because I certainly know everything is not a physical therapy issue. Some things are medical,
Yes.
things are emergencies. And so for sure, um, the Instagram is Woodlands PTAR, and you can even send me a DM on Instagram, and I will be more than happy to meet with you, kind of discuss some things that I think may be beneficial,
Hmm.
and follow up with you from there.
Okay. Well, it has truly been wonderful. We can still continue to talk. We still have a little bit more time, but are you doing any lectures or anything like that that's coming up?
Yeah, so I have an event that is a sewing event that's coming up February 25th.
Okay.
And I'm also doing a conference with Miss Michelle, but she's going to give me the details on that, and I'll be able to let you know. So those are right now the two major events that are on the calendar.
Okay, okay, sounds great. I'm loving it. I think I said that wrong. It was Woodlands
Eh,
PTAR, right?
Yes.
That. Okay, so I want y'all to make sure that y'all do reach out to her on IG at Woodlands PTAR. And I know that if you have any questions for her, you can always,
Yeah.
always, always, contact her about that. And also follow up with her in regards to the two events that she's going to be having this year so far. I'm pretty sure that there's going to be so much more to come. I'm sure of it. I am sure of it.
Yeah, just
So
getting
this is
started.
certainly very exciting, just to hear all the diversity of what you do and the mere fact that you deal with the body, mind, and spirit. That is really wonderful.
Yeah.
It's so wonderful. Um, because, like we mentioned a little bit earlier, that's something within our community that we just don't have enough information about, that we do not have to be bound by pharmaceutical
Yeah.
medications. We do not.
Yeah.
And the counter effects that it have,
Mhm.
you're taking a medication that specifically is for one thing, and then it ends up where it deals with your kidneys. And
Mhm.
then there is even some that affects the lungs.
Yeah.
And it'll tell you on there it'll tell you on there that this may affect your
The
breathing.
commercials get so scary. If you or a loved one have died from that, you're like,
Yeah, those are the worst ones, when they tell you if your loved one has died from this or that. And
yes,
it's
we
like,
don't have to keep dying.
we don't. We
Yeah.
can live and live a prosperous life, a quality of life.
Yeah.
It's just as simple as having that lifestyle change, and being committed to that, being committed to it too. And I think that was one of the two things that you ask your patients about is, are you ready? And
Mhm.
what is your quality of life? What do you want for your quality of life? That is, ah, priceless right there. That is priceless, priceless questions, because that usually have an individual to want to do more and want to do better
Yeah.
in regards to their health. So I am going to, I hate to let you go, uh, because this has been so exciting. It's so
Yeah.
wonderful to be able to talk to someone that is actually in the field of medicine, that is doing it differently.
Yes.
Oh,
I've been very honored. The day I met you, I was like, I'm on your same wavelength. Yes, I was so excited, when I met you. And then when you asked me to be a part of this, I was just very honored because I just feel that this is something that I have to, get out and say and teach. And I definitely feel that, I don't want to say burden, but that desire to
mhm.
do that. So I'm happy to have this as a platform to be able to express this, and grateful for the opportunity.
Oh, the pleasure has been all mine. Truly, it has. I want y'all to, I just want to say thank you again, Dr. Shedel. I so really, really, really appreciate you. I'm going to put her name back up here again, just in case you guys need to see it. Remember her. Do not sleep on this woman, because there's so much that she can actually teach our community, which is so needed. It is
Yes.
so needed. So if there's people here that will, or that want to have her to speak with you on a personal level, on a professional level, like I said, I see this where there's going to be a lot more talking events for this year for you. I really do see that. I believe God. I
Um,
I, I am that way.
yeah.
Whatever it is that I see, I know it's real. So it's gonna happen. It is
Yeah.
definitely going to happen. And so we just thank God for this. We praise God for Him, for just blessing your life and using you as that vessel to be able to speak to our community,
Yes.
because it's certainly needed. It's certainly needed. It's certainly needed. We do not have, and you were right too. I have seen this more and more. How 30-year-old
Mm-hmm.
women,
Yeah.
30-year-old women that getting cancer now.
Yeah.
It's just something that used to come long time ago no
Yeah.
longer is that. It's not a, a real long lifespan of
Yeah.
when these particular type of diseases or illnesses are hitting our community. They're
Yeah.
coming a lot earlier than they used to. And then also mental health. uh, it is just is baffling to me how the mental health in our community, we have that number has increased tremendously on the individuals that are either on medications that are the wrong medications for them, and that's one of the reasons why they don't stay on it. Another thing is that it could be something that is spiritual,
Yeah.
and or mental,
Hmm.
as far as, or emotions, I should say, emotional, a thing that just needs to be broken off of their life. So it's all of these things, but if you're not talking with someone that is a true believer, and they're not speaking to you like that, but every 3 months you're just coming in for medication, then what
Yeah.
are you gonna do? Continue to take
Suffer.
your medication. And
Yeah.
there's people that have been on medications, the same medication for 20 some years, and
Absolutely.
it's just unbelievable, unbelievable. It's such a trap.
Yeah.
But that's just, like I said, I want to be careful on how I say it, but it's a trap. It is. It's a
It
trap.
is. It
Mhm.
is.
Yes. So, again, I want to thank you so much. Thank you for your time. I appreciate you so much. May
Yeah.
God continue to bless you, as I know that He is, and prosper you. And also, and I thank God even for brightening and widening your territory.
Amen.
You are not limited. You will be all over this world. Everyone will definitely know your name. So thank God for that. And for all the ones who came on, we have our wonderful Michelle. We're gonna see her next week, y'all. She's gonna be on next week.
Yeah.
So, so I just want to say thank God for each and every individual that tuned in, and for the ones that's going to be tuning in a little bit later. May God bless you. May God keep you in Jesus' name. Have a wonderful and blessed night.
Amen. Good night.